Good morning, viewers. The problem with India is we are consuming very low milk when compared to Western countries, and now there are health terrorists have come out who are talking against health milk. The problem with India is there are experts in economy, experts in financials, experts in cricket, and experts in space technology. For everything, all the 150 crores are nothing but fully trained like chat GPT. They are all pre-trained, already generated. With knowledge they are born. So for them to tell them that milk is very important is become a big headache. There is a number of studies that milk can reduce the incidence of diabetes. Unfortunately, in India, people they are not taking the milk, and especially among diabetics and especially among women, there is a fear that if you take milk, the blood sugar will go up. A post-menopausal woman, our calcium scores are very low in India. Moreover, they say that by taking milk, the blood sugar will go up. They stop taking milk. But milk has many protective biopeptides. These biopeptides see that you will not develop blood sugar will not go up. The diabetes incidence will come down. These biopeptides act on the pancreatic beta cell and produce the insulin in the required quantity. By that, our blood sugars will come down, mostly because of the calcium that is there in the milk, which is causing lowering the blood pressure, and it is stabilizing the lipids and reducing the diabetes. Not only with calcium, now there are cardiac and desire. These are two major studies that which come 9-year studies, and NERSA study is one study, 10-year study, where people have consumed full milk. They all could reduce the amount of diabetes prevention. They could reduce the amount of diabetes burden. So type 2 diabetics, they can freely take milk. There are 3 types of milk products when we talk about milk. First is the complete milk, second is butter, and third is cheese. Out of all, cheese has a lot of calcium, and it has been proved very useful in diabetes. So in India, we are poor, but we are also functionally, brain has gone dysfunctional. With this and with the software that has gone up and graphics, and with online, we have a lot of super consultants. With all the small mobile also, you can record video and tell whatever you like. Because of that, there are a lot of fear among Indians to take milk among diabetes. So every diabetic patient can freely take milk. The milk consumption especially has proved to reduce insulin resistance. So HOMA IR values have come down by taking insulin. So HOMA IR is fasting insulin to fasting blood sugar divided by 405. It is more than 2. It indicates your insulin is not working. This is called insulin resistance. As you can see here, calcium, potassium, magnesium, they are all there in the milk, and polypeptides, which are bioactive peptides, are there in milk, which are reducing the insulin resistance and also reducing the diabetes in the blood sugar. So implication for diet recommendation is there is a protective effect of milk among diabetes, and in camel milk in Saudi Arabia they are done, which has been proved to be very successful in fatty liver. So modified milk have been tried now with where they are using a milk fortified with a starch called dextrin, which is resistant when it comes to the colon, so that there will be more amount of MCFA, middle chain fatty acids, and gut flora are improved, and by this they have reduced the diabetes. So another doubt is, should we take low toned fat milk or full cream? This one more class I am going to tell. Now presently we are advising full cream, and there is no incidence of increasing in heart attacks or diabetes by taking a full cream. Actually, the protection is more when you take a full cream milk. So I am conducting 12 months class for general public and for doctors, because metabolism we are not teaching in medical college. Lot of doctors have forgotten physiology. And applied physiology is metabolism with nutrition. There are hundreds of doubts. So 600 classes I am taking in a 12-month course. You can come to my website www.homahealthcarecenter.in, or you can call to me. My number 0996 3721999. My name is Dr. M Surendra Nehru MD physician. Kindly join Quit India Diabetes and Obesity campaign, and we have to everybody has to take a role. Otherwise, in digital media, there are digital terrorists have come out on health. They are destroying the health of the every Indian, and we can't stop them. So unless people get a proper education about health, after the age of 50, it will be a big problem, and 30 crore Indian poor obese diabetic patients are going to happen from 2040, and there are nobody to look after them. Unless we form a Quit India Diabetes and Obesity prevention campaign, it is not possible. So kindly join and prevent or reduce diabetes burden and obesity burden in India. Thank you.